To get started, we'll look at low back pain. We're sort of looking at money in the bank sort of problems. These are the things that we've had come into us for the past 30 years on a regular basis. The kind of problem that many, many people have and are amenable to treatment quickly and easily in most instances. So we're happy to do this. One of the first things we need to recognize when we do the history is we'll hear the fear in the person's voice. We'll understand that they're afraid they'll never get better, because this kind of low back pain, this garden variety low back pain, creates unbearable levels of discomfort. And so typically the person has to crawl to the bathroom the first morning it happens when they wake up. As body workers and massage people, what we need to be aware of is face down oil massage is generally contraindicated. What it does is it creates gelling pain from people being in a static position for too long. And so we move people many times, 5 or 6, 7 times even in a 45-minute session when we're working with this kind of pain. Getting them up and moving and stretching is real important. But first we have to get them in pain-free mode enough to be able to move. The muscles that usually occur in most back pain, 90% of back pain is muscular. That's been our general consensus. The rest of it is that 90% of that 90% is in the quadratus lumborum, the gluteus medius, and the gluteus minimus. And so those are the mainstays of the treatment. There are some secondary muscles that we're going to treat because they tend to rekindle the trigger points in these areas. Again, a trigger point is a hypersensitive area in muscle that's locally tender when pressed and has a referred pain pattern. So we'll talk about the referrals of these pains, how to treat them, and get people better really quickly. Now, if they don't get better quickly, it's time to refer them. So we've got a couple of differential diagnoses in the bodywork sense, which is we'll look at other muscles that can cause us similar kinds of problems. But this is the mainstay right here. This is what we found useful on a regular basis. So the first thing we do is have our client sideline. So Pilar, if you'll roll back toward me, extend your hip right off the table, so way, hyperextend. There you go. And your arm above your head. The arm up pulls the rib cage up, the leg back pulls the pelvis down. That gives us a better shot at the quadratus lumborum. When we palpate her spine in the back and just move off us, we feel the paraspinals. Just in front of the paraspinals and deep to them is the quadratus lumborum. The muscle has 3 different distinct layers. The main layer that runs from the 12th rib to the posterior crest, and then we have from the posterior crest to the transverse processes of the lumbar spine. And then we have the 3rd layer, which runs from the 12th rib to the transverse processes of the lumbar spine in a different diagonal. So there's actually a crisscross kind of action. And there's deep and superficial trigger points in this muscle, and they refer into different parts of the body, but they're all in the hip and low back, and a little bit in the upper quadrant, lower quadrant on the same side as the quadratus lumborum. So some of the referrals actually wrap around the hip and come around to the front. So what I'm going to do is palpate her rib cage and then slide down just slightly.